Hey everybody, Dr. Corwin of Follicle HT. What I want to talk about today is who is a good candidate for a hair transplant. The general answer is men or women who are experiencing gradually progressive hair loss or hair thinning, who are just unsatisfied with the appearance of their hair. In men, the hair tends to recede in the frontal hairline and temples and in the crown area. In women, there tends to be a more diffuse thinning throughout the mid-scalp area, leading to thinning and a see-through appearance, widening of the part. Now, the commonest cause of hair loss in both men and women is androgenetic alopecia, or genetically mediated hair loss. But, and particularly in women, often there can be other underlying causes, like hormonal imbalances, nutritional deficiencies, etc. And sometimes these need to be investigated and corrected before somebody's a candidate for a hair transplant, which is why it's important that you go to a true expert in hair restoration who will be equipped and has a good understanding of the potential underlying causes of hair loss that may need to be addressed prior to a transplant. Another very important consideration is age, particularly in young patients, which is why we are often very reluctant and will rarely transplant patients who present in their late teens or early 20s. The reason for this is that at that young age, it's sometimes very difficult to tell the ultimate rate and extent of the hair loss that the patient will ultimately experience. So there's a risk of committing a young patient to an aggressive frontal hairline, and that if they have progressive loss over time, there may not be adequate donor hair available to keep up with that progressive loss. So in young patients, we have to be very cautious, and we will often rely on medical therapy to stabilize the patient prior to consideration of a hair transplant at an older age. So at the end of the day, ultimately, a good candidate for a hair transplant is a patient who is losing hair, is in a good frame of mind, has a good understanding of the procedure in terms of the anticipated outcomes, the limitations, and the risks, and is ready to make a positive change.